All right, welcome back to PT Mill Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all served in a hearty conversation about physical therapy, profession, and practice with a Filipino flavor. I'm your host, Johan de la Paz, and today we're serving a topic that's not often on the table, but absolutely needs to be: pelvic health for men and people with male anatomy. My guest is Dr. Cris Dervin Fedalizo, physical therapist, founder of Artizo LLC in Northern Virginia, and one of the few physical therapists specializing in pelvic floor rehabilitation for men. So Dervin helps people regain control of their health, confidence, and peace of mind, addressing pain, leakage, and sexual health concerns that many still find hard to talk about. So today, we'll unpack the myths, misconceptions, the science, and the stigma behind this often overlooked area of care, and why, as Dervin says, pelvic health is everyone's health. But before we dive in, don't forget to follow and subscribe to the PT Meal Podcast on Spotify, Apple Podcast, Google Podcasts, iHeartRadio, Amazon Music, and wherever you're listening to. You can also catch the video version on YouTube. Hit the subscribe button and the notification bell so you never miss a serving. And stay connected with us on Facebook, Instagram, and LinkedIn at PT Meal Podcast. And check out the website, ptmealpodcast.com, for updates, snippets, and conversations beyond the mic. So, Dr. Cris Dervin Fedalizo, welcome to PT Mill Podcast. How are you?
Hello, mabuhay kababayan. Well, thank you so much for inviting me in your podcast. It's definitely a platform for every physical therapist, and even I mean, not even your even not your non healthcare professionals. I would say it's always a pleasure to meet a fellow kababayan who is in the same field, making changes in our community, especially here in the U.S. And your podcast definitely reaching out back to our home Philippines. So
Thank you for saying that. And I'm glad, and it's my pleasure to have you here in my podcast to talk about pelvic health for men. It's a topic that not many PTs talk about. When patients don't really try to talk about those things. So this would be an interesting topic for our listeners and for probably new audience that we have gonna have. So before we really dive in to our topic, could you give us a short background on how you became a physical therapist? Because I usually ask my guests how they got into the profession, so that probably students or like high school students also try to listen to this, and they try to be inspired and see what if physical therapy is for them. So what led you to our profession? How did you become a physical therapist?
that's very heartful question that we shall all go back to 2006 when I graduated high school. And my older brother is an instrument for me to take physical therapy as a pre-med. I really want to be a doctor, be part of that field where we want to make a difference, cure everyone's diseases. And I found UST. University of Santo Tomas is definitely the lead in healthcare, especially in the Philippines. So physical therapy was supposedly my pre-med, and I decided to finish my 5-year course in UST and come here in the US. Physical therapy has been a huge part of my life, especially when I was taking care of my grandma after his hip replacement here in the US. And I found how it was very helpful for her to get back on her feet, walk again, and enjoy life, especially back in the Philippines. We just love to walk around and talk to our family and friends, go to the mall, enjoy the AC, especially in summer. So that really made me think that physical therapy is the profession that will change my life. And here I am, here in the US, working as a physical therapist for 14 years now, and I still enjoy doing what I do.
Cool, cool. A lot of PTs also trace their roots in thinking that they're gonna do it as a pre-med, and then they found that they like being physical therapists, so they stuck with it. Not many physical therapists, or even guys, male physical therapists, go into pelvic health. So let's go into that topic now. So what's your turning point? So what convinced you into going into this field?
Yeah, I would say that It's the stories of all my patients who have turned me to become a male pelvic floor physical therapist. It's their stories that made me realize that this is my calling. I see every patient coming to me with frustrations, anxiety, hopelessness. They're scared of what's going on to their body. They are unaware, uneducated that the physical therapy can make a huge difference. A conservative treatment can help them instead of just taking antibiotics, going to a chiropractor's, getting massage, and still, or one more thing, and even just researching on the internet, finding solutions to their problems, and me coming in to help them make changes even after a session by just educating them gives them such a huge relief and hope, a relief that will bring them back to their family, back to their work, their the satisfaction that I see from that moment makes me realize that yeah, this is my calling.
Or was there any particular instance or particular story or patient that kind of led you to this trajectory of specializing in pelvic health? Will you be able to recall a specific patient or story?
A story. There are just multiple patients that I've seen in the past. I've been practicing for a few years now, but most recently, the patient who actually this one, there's this guy. Let's put a name on this guy so it's easy for us to talk about it. Let's call him Carlo. Okay, this Carlo is a 60-year-old guy, just had a prostatectomy for 14 months and still having leakage. And he is very hopeless about getting back to work because he's always leaking. He's been wearing Depends. Depends is a kind of an adult diaper that men wears at work anywhere they go. They gets bulky because their incontinence, their leakage is more than 300 ounces, shall we say. It's more than a pad, a pad that women that wears. So they're wearing Depends. So this guy came to me really asking for help. And I've seen him consistently for twice a week for 2 to 3 months. After that, I've told him that there are other options aside from physical therapy, but he told me that he has trusted me so much that he will go to the road of conservative treatment. So he put his time, effort, and energy in doing all the exercises, not just exercises, by the way, but reflection, looking inside of him. What are the reasons why he's leaking? So, and recently he came back to me after 9 months of physical therapy. Well, of course, I already been seeing him once a week, turned to once a month, and then last week actually he came back to me after 9 months or 10 months of physical therapy. Told me that he had a zero leakage. So and he was very happy talking to me. He gave me a teary eye, telling me how much difference I have made in his life, how much impact I have put into him that changed his entire life, work and personal life. He was happy that he doesn't need to have a surgery.
Mhm.
Right? Who wants to have a surgery next to their penis after all? So I think that Carlo is one of the guy who I will never forget.
That's a great story because we often associate getting older as it's something normal to have some leakage, but
Mhm.
that kind of example working with physical therapists, you can change those things and improve that. So for those who are listening to this topic for the first time and hearing leakage, pelvic floor, could you give us could you describe to us what exactly is the male pelvic floor and what it actually does?
Gotcha. Yeah. Well, in layman's term, we could say that the pelvic floor muscles are the muscles where you're sitting at. All of us sit at work, when we're driving to work, when we're having our breakfast, lunch, or dinner, when we're chatting to our friends. So if I know we're in Zoom, and most of us orthopedic, I don't know if you can, we can, those viewers can see it. So I brought the bones. All of the physical therapists know the pelvis, but not a lot of people know that our pelvis is different from hips. So here's the thing. This is the pelvis. All right. And not a lot of people that also have seen this model. Right. Mm-hmm.
That's really a requirement for pelvic health.
Correct.
Physical
As a physical
therapist.
therapist of men's pelvic health, we need to be visual
Visual.
for every man because not I would say 5 or 10% of people already did their research on what is pelvic floor, but the pelvic floor muscles is the muscles where are sitting at. It's inside. It's in our buttock muscles. So you can see here the pelvic floor muscles and the interior part of our pelvis. And then on the other part, that's also part of our pelvic floor muscles. So there are 3 layers of pelvic floor muscles, and they are all connected intricately to our body using with a fascia. So our pelvic floor muscles are even connected to our jaw, all the way from our jaw, all the way from the scalp down to our feet. That's the core of our body. Pelvic floor muscles, the muscles that we always sitting at, is the core of our body.
So it's at the bottom of our pelvic bones, and it supports our
Correct.
our bladder, our bowel.
Correct. So to make it easier, pelvic floor muscles, if you're thinking about its function, bowel, bladder, and intimacy. That's the basic of the pelvic floor muscle function. That's the basic function of our pelvic floor muscles. But we should not forget that it also functions as part of our posture and stability and the sump pump. It also helps with the distribution of our fluid back to our abdomen, where all the lymphatic vessels are located at. Right?
Oh, I haven't thought of the pelvic floor muscles as something that could contribute to posture and lymphatic. That's good to know.
Yeah.
So in your practice, in your experience, what are the most common pelvic floor issues that you see among men? What are the symptoms that they usually come into in your practice? And then if there are any symptoms that they often mistake it for something else.
Mm-hmm. Well, the most common symptoms that I see in my practice is pain.
Mm-hmm.
Pain is a complex output of our body. When we feel pain above and below the belt, we connect it to several things, several parts of our body. And part of the pelvic health is to understand where is that pain coming from. And knowing, and just so you know, being a pelvic floor physical therapist, you should not be disregarding everything that you learned from the past. You should just be integrating everything that you know with the pelvic floor muscles, because that's how you are going to solve where's the pain coming from. The pelvic floor muscles is just part of a bigger picture of pelvic pain. So that's one of the most common symptoms that I've encountered. Second, I would say erectile dysfunction. Erectile dysfunction is such a big diagnosis that there's a lot of components that you have to think about. And pelvic floor muscle is just one part of it. I'd like to share that men should not be taking Viagra right away, taking antibiotics right away. Go see a doctor, listen to what he was thinking, he was saying, follow the test that they want you to do. And if they prescribe you medication, take it as long as they have the basis of why are you taking that medication. And we are so lucky here in the US that we have a direct access. So seeing a physical therapist is such a privilege for us because knowing the physical therapist knows a lot. And we can diagnose, we can rule out and refer patients if they have problems going on in their pelvic floor muscles. And men think about that ED can only be resolved with medication. And I hope this platform will help every man to realize that our pelvic floor muscle could be part of your erectile dysfunction. Back pain, I think it's such an easy way to understand that we should be thinking about our back, our canister and abdomen, like a back is like a canister, right? We have our abdomen in the front, the transverse abdominis, if you know, right? Everyone knows about that. It's such a like our go-to exercises for back pain. That's the front, and the back, our back muscles, the rotator muscles, our small muscles on the back, our diaphragm on the top, and on the bottom is the pelvic floor muscles. So let's not disregard our pelvic floor muscles when we're thinking about back pain. Because remember, our posture, our back is like a canister. So you have to think about the front, the back, the top, and the bottom. So just to name a few, I think there's a lot of symptoms and possible problems that I encounter, but that's some of them.
I'm curious about pain and pelvic pain. So
Mhm.
when you encounter pelvic pain, how do you make sure that it's or how do you say that? How do you know that it's really from the pelvic floor and not from somewhere else?
So if we are going to rule out everything,
Uh-huh.
and you want to know if it's really coming from the pelvic floor muscles, you need to make sure that your pelvic floor physical therapist has gone to a proper training because the best way and the only way to assess pelvic floor muscles is using our index finger or our entire hands, right? So you can check your pelvic floor muscles from the outside. From the outside, part of our pelvic floor muscle is your butthole. We call it external anal sphincters on our groin area, which is your iliac cavernosus, and just behind your scrotum or your balls, which is your bulbocavernosus cavernosus. And these are all your superficial pelvic floor muscles. If you insert your finger inside, you might pass out. Thank you. So I have a 2D of our pelvic floor muscles. By the way, this is the superficial part of our pelvic floor. By the way, here you go. It's a superficial part of our pelvic floor muscles. Your iliac cavernosus, your bulbocavernosus, your external anal sphincter, and I even forgot the superficial transverse muscles. And from the inside, if you insert your finger, you can see once you feel that ledge, when you're on the ledge of your pelvic floor muscles, you can check externally all the pelvic floor muscles, starting from puborectalis, pubococcygeus, which are both very important for bowel movement. Iliococcygeus, which is just on the side, and ischiococcygis, which is all the way at the back. And let's not forget the obturator internus and your piriformis, which becomes part of the pelvic floor bowl because they are on the front and the back wall of the pelvic floor muscles.
That's really helpful having those visuals. I think that's going to be very helpful for patients to see those muscles and where they're located. What's usually like the common causes of pelvic pain that you've encountered? Is it like trauma? Is it just something, I don't know. When you see your patient, what's usually their like causes of their pain?
Right.
I could only think about trauma, like something hitting them. But
Yeah. Well,
what's usually the common causes of pelvic pain?
right. Well, I forgot to share with you that when you feel pain
Uh-huh.
on those muscles, remember if we have pain in our chest and our biceps when we work out, we call them knots. Lamig.
Mhm.
In the Philippines, we call it lamig. I was
Right.
trying when I came back to the Philippines. I was trying to explain them what is lamig, which is like knots, right? So those are knots. We call them trigger points, and those trigger points are the source of pain. And just like anything else in our body, when the muscle constantly contracting, it develops not taut bands, knots, lamig, and that becomes a source of pain. But it's very unique for pelvic floor muscles. It's, what shall I say? Nasa isip ko is Tagalog. So pelvic floor muscles is very, paano ko sasabihin? So pelvic floor muscles are controlled. There you go. Our pelvic floor muscles are controlled uniquely by two systems, which we all know, the voluntary system, right? Where you can control it voluntarily, and the autonomic nervous system, which composed of parasympathetic and sympathetic nervous system. So you can squeeze your pelvic floor muscles voluntarily through the pudendal nerve, And because of its unique anatomy, shall we say, physiology, it's also controlled by the autonomic system, parasympathetic and sympathetic. Parasympathetic is our rest and digest. If you want to relax, that's what your pelvic floor muscles will relax. And if you're in high stress, because you have a lot of what do you call this deadlines at work, if you have meetings to attend to, if you are dealing with someone who just died, if you are dealing with a lot of social issues, especially here in Virginia, most of my clients work in the government. Most of them carry their stress on their pelvic floor muscles, and and that constantly contracting because their sympathetic nervous system is up regulated, shall we say, their cortisol is up, and not just and it shows in their pelvic floor muscles.
Right. The only when you're talking about the parasympathetic sympathetic nervous system, there's a mnemonic I remember, and I don't know if it's related, but I just want to share. I don't know who said it, but I remember point and shoot. When you say,
Oh yeah,
if
point and shoot.
point is letter starts with letter P, so
Right.
it's
Uh-huh.
it's from the parasympathetic
Correct.
nervous system, and shoot is ejaculation. It's coming from the sympathetic.
Yes.
So, but by that and how you're explaining it, like if you're stressed out and you're a lot of like your sympathetic nervous system is triggered, and then that might cause some facility, it might cause erectile dysfunction. Is that connected?
Well, our body is naturally, what do you call this, inhibiting what do you call this, the parasympathetic. So we are naturally, I think we are naturally in high stress, and our body will just have a hard time relaxing our body. So to answer that, I think when you are in high stress all the time, your cortisol level always up, the cycle will not give you erection because you're in high stress. So
You need to be relaxed.
so you need to relax so that you can have your erection.
Mhm.
Once you get your erection,
Uh-huh.
then you can ejaculate again.
Right.
So I think that's the side. That's a unique part of our body. You cannot just get erection all the time because your sympathetic nervous system is up. No, you can't. You need to break that cycle of sympathetic nervous system to get the erection because it's the nitric oxide that will bring blood flow to the penis
Mhm.
that will give you erection, and that is regulated by our sympathetic nervous system, right?
It's so we're talking about it, erection.
I'm enjoying it. The science is so deep. I wasn't expecting this. I would like to share with you before this. Oh my God, where's my book? This is one of my Bible.
I
My
have that
Bible,
audiobook.
first book that I've read was the penis book. And I will never forget this. I read this from front to back, day and night before going to bed. I was thinking about, oh, with the dick, that penis is it's such a wonderful part of man. And sex is fundamental part of man's life. So let's not forget about this, right? So this penis book, listen, read it.
Yeah. I got that in audiobooks. I saved in my Kindle.
Gotcha. Yeah,
Amazon.
I think I'm on my second round of reading it.
So it's for us. It's easy to talk about sexual dysfunction, pelvic pain, leakage, but there's still a lot of like taboo around surrounding it, stigma around it, especially in the Philippines where men mostly don't want to talk about their problems in general. In your experience, what are the common myths or misconceptions that you run into often?
Well, the number one myths that everyone think about that pelvic floor muscles and pelvic health is only for women, just because of the Kegels. Kegels was discovered by a male doctor for what do you call this? For those who just gave birth, right? To strengthen their pelvic floor muscles, and because of that, that just becomes the norm. But let's not forget, everyone in this world, including men, has pelvic floor muscles. So they have to take care of that. And what else? Another one, maybe pelvic floor is only for those who had prostate surgery. Sadly, here in the US, it's very common for at the age of 40, if you have a family history of prostate cancer, you have to get it checked. Please go get it checked. Age of 40. And if you think that if it's going up slowly, be mindful of it because you are at risk, especially if you have a family history. I'm sorry. Sorry, I'm squeezing this squeeze ball that I have. Oh yeah, so and I think people think that all the answers is Kegels. No, Kegels is not the answer for everything. We are now at this age, we are now at this time that research has gone so far that Kegel answers everything. I have a patient who just came and see me the other day. He's a nurse. He's a 50-year-old nurse. Let's call him Jordan. Jordan came to me and said, "Hey, I'm having this. I've been going to the bathroom so often, and all I've been doing after I see my doctor, who told me to do Kegels, and he's been doing the Kegels, and he's not getting better." And he actually flew from Ohio. It's very hurtful for me because he even flew from Ohio because he found me. And Ohio is not far, by the way, from Northern Virginia. And he flew over and said, "Hey, I'm looking for a counselor physical therapist. I saw you. You're one of the only few, and I would like you to check on me." And after 3 PT sessions, he learned a lot from not just learn a lot about pelvic floor, and he was able to apply everything that I taught to him. And he sent me a text, wrote me a good review that it works. Everything that we've done works. So Kegels not the answer for everything. One more thing I would say: if you get an erection, you think your pelvic floor muscle is fine? No, because there are some clients that I see who have premature ejaculation, who doesn't have they have a decreased sensitivity in the area or have a post-ejaculatory pain. So let's talk about premature ejaculation. I have this patient who let's call him Sean. I'm a friend here. My name is his name is Sean. Premature ejaculation. So and by the way, all of the names that I have is aliases. Okay, not off
The real
aliases of my patients, but these are all real stories. Sean came to me and he told me, "Hey, I would like to have, I would like to make my family bigger, have another child, but I cannot. I mean, I just ejaculate too soon." And he came to see me, eight, had eight physical therapy sessions, and after that, he understood that not just because of you got erection, your pelvic muscle is fine. You have to address other things. Second, pain after ejaculation. Yeah, you get erection, then you have pain after that. He went. Oh, let's call him Michael. Michael have pain after ejaculation, and he said that he already went to the doctor. He already had the PSA test, completed the antibiotics, but he's still having pain. He came and see me, and then he told me that after the stretching, the mindfulness, breathing, and have a deeper connection to his body, finds answers that can resolve the pain. So the physical therapy is just part of a bigger picture. Physical therapy is just a wheel to make changes. So I think those are some of the things that I remember. That's good. Those are all good.
Oh, okay. So pelvic floor is not just for women.
Correct.
Kegels is not the answer for everything.
Correct.
Because that's what people know about pelvic floor. Just do Kegels. Just strengthen it.
Correct. Yeah.
Yeah.
Just do the Kegels. That's the answer for everything.
No,
That's
that's
the
not.
answer for everything. And even, I mean, I've read this research about very recent. Forgot the name of the guy, but he they found out that since people think that pelvic muscles are just squeeze it voluntarily, they will improve their urinary incontinence or leakage. But I have been applying a lot of bilateral movement, changes in balance, reflexive throw, catch, ball drop, mental challenges. to my practice to improve the pelvic floor muscles because pelvic floor muscles, it's not, they just don't contract voluntarily. It contracts before you hit the ground when you walk, when you're walking. It has a connection to your brain that prepares the pelvic floor muscles before doing anything, before you do something. So yeah, it's a reflexive muscle. You gotta be, you just don't squeeze it and get better.
Right. So part of your
Right?
some of your treatments involve not just the pelvic floor, but the whole body.
Correct. Yeah. You treat the entire, if you're seeing if you're seeing a man who have pelvic floor issues, you see them as a whole and you just don't treat them how to squeeze it.
Mm-hmm.
You teach them how to prepare prepare themselves in doing things because your pelvic floor muscle is an anticipatory muscles and they work very well when you surprise them, shall we say. Surprise them and you involve both hands
Mm-hmm.
a lot. Okay, here's the thing. You also have to think about coordination, timing, speed, power when you are treating the pelvic floor muscles. That's the advancement of treatment of pelvic floor. Yeah,
That's new to me. I haven't heard that, but that's great.
yeah. There's a lot. Yeah, there's research for it. I should. Yeah,
So we've been talking about pelvic pain, premature ejaculation, pain after erection, and all of that. And for people who have, who this is their first time to of hearing this and maybe unsure of if this is for me, is this something I can do? Can you walk us through on what their first session would look like or what they can expect? Or especially those who are those men who are you feel awkward, probably embarrassed to share things or show things. How does the first session look like when you're seeing a pelvic floor physical therapist?
for every man who come and see me, I already give them a big smile because they are coming very. First of all, they're scared. They are hopeless. They are uneducated of what's going on to their body, especially below the belt. So giving that smile to them, makes them, it reassures them that that I have the answers, that I could help them. So it's the first impression lasts. So we say that, right? So you have to set a good impression to them in the first session. I make sure that the private room, again, a private room, you don't see this man in a public area. You need to bring them to a private room that is where they will feel safe and judgment free. When these men are when this man come with me in the judgment free zone, I always give them a disclaimer so that they can have an open discussion with you. At least 10-20%. They will open up to you. And you have to break the wall slowly, giving them the assurance all the time that they are in safe environment, that I will be with them in this journey to resolve their issues is very important to them. I always make sure that they feel strong, confident, and control because that's what men wants in the end of the day. They just want to get their independence back. They want to get back on the activities that they love to do. I'll never forget this one experience that I have. Oh, actually, three experiences. Oh, this is such a wonderful time to reminisce this. One moment, let's call him Paul. Let's call him Paul. Paul was brought by his wife to me after his prostatectomy because Paul is a macho guy who believes that everything will get better after 3 or 6 months. So since they are not aware of what's going on to their body, Paul's wife Paul's wife motivates, educates, supports, becomes a caregiver of Paul, brought him with me. So in that first session, I even asked Paul. I asked permission to Paul if he wants to bring his wife inside the private room. Again, this Paul is an adult. Let's not forget that he's 60s, 50s, 60s. He's an adult. Gotta ask permission as well if they want his wife to know all the things that we have to talk about. Now, it's hard for Paul to open up in the first session. Second session, he slowly opened up. And look at and hear me. Fourth session, he ghosted me. He ghosted me. Paul did not show up. Paul's wife called me and said, Paul doesn't want to come to physical therapy anymore. So for me as a physical therapist, I've done my part. I do everything that I can to educate him, to give him all the assurance, guidance. But again, it's his decision that he doesn't want to do the physical therapy.
In your practice, do
So,
you normally, oh, sorry to interrupt you.
yeah.
In your practice, do you normally ask someone to chaperone during the evaluation? Because I think because it's such an intimate area, and some physical therapists in the pelvic floor scene for their safety would have a chaperone during evaluation. Do you do that for all your patients, or do they sign like a waiver or whatever that they chose not to, or what? How do you do it in your practice?
So in my practice, I always educate them written paper and verbally that it will be an intimate. So it's an intimate or that this pelvic floor physical therapy is different from the traditional physical therapy. And I always give them the option
Mhm,
if they want to have a chaperone.
mhm,
But again, this we have to think differently because I am treating men. I'm only treating men. And mostly men don't want to share their information to other people. They want to keep it as private as possible. They men only come to see me because they already have exhausted all the avenues and they still have problems. That's one scenario. So I think the good thing about my profession as a male pelvic floor physical therapist, it's not they don't need a chaperone
mhm,
to answer that.
mhm. Oh, okay. Do you also like do when they come to you, do they already have an idea that you're that they may be, they would take their pants off and they would show it to you?
Well, two scenario. There's always two different side of the story. I have one client. Let's make him running out of names.
John,
Scott. Scott.
oh Scott.
Scott.
Okay.
Scott is a macho guy. He doesn't want to. He doesn't want to. He's just coming in because his urologist told him to come and see me,
Mhm,
and I educate him. Most of half of my session is through education, and I always tell them that as a pelvic floor physical therapist, you can take advantage of my education by looking directly right away to your pelvic floor muscles. And he said no, he doesn't want to be touched. So I told him that's fine. We can look at the other avenues, other parts of the pelvis, which is their back, hips, knees, that could be contributing to his. There's another, on the other hand, let's put his name Saul. Saul did his research. Saul was so eager, like, hey, let's do this. I just had hemorrhoids, had a surgery. I want you to check my pelvic floor because I want to make sure that I will not have another what do you call this? Another episode of rectal prolapse. Rectal prolapse means their rectum just that some tissues of the rectum just went out. So yeah, I think it depends on the patient. I need to meet every clients in the personal level that they're comfortable of. I want to meet them in their common ground,
mhm.
and that's when we're going. That's where I'm going to decide if I'm going to treat them from the outside to inside or inside from the to outside.
Very education and communication is really important in that sense, especially in
Yeah,
that session.
yeah.
Pelvic health is part of everyone's health, even men's health. What would, for you, what would it take for that idea to really sink in, especially in the healthcare system and in men in general, especially like in our practice in the Philippines? What do you think? what should happen for that idea that pelvic health is something that is going to be something that we should focus, look into as well, not just for, pelvic health problems or issues.
Mhm. I think to make men's pelvic floor be part of the healthcare system, we just have to normalize the conversation. But it is tough.
Mm.
I'm sorry to say, for men, it's the toughest discussion, conversation that to be part of. But that's the number one thing that we should do. Make it normal. Make it. Why? How come women can talk about their leakage when they get together? When they get together, women who just had baby, they talk about their leakage when they were laughing and they refer to pelvic floor physical therapists right away. But for men, it's just a tough part. We just have to normalize the conversation. Make sure that we advocate for our patients. Everyone, for every physical therapist saying, which is actually, this is one thing I learned. Every time I see my patients is in orthopedic approach, who has back pain, hip pain, any problem that they have above and below the belt, just ask them nicely, with permission, or even give them a screening form if they have any bowel, bladder pain or intimacy issues, because they will appreciate it. It's very, so I'm very happy to be a physical therapist because we can spend an hour, if we're lucky, 30 minutes to an hour of our time to our clients to get to know them very well and ask them if they have problems, if they have any concerns. They will open up to you. Once they open up to you, it will be easy to talk about these issues, especially for men.
What do you think about
Yeah.
including or putting more focus on pelvic health in general in physical therapy education? Is it something that all entry level physical therapists should have an idea? Like, because I remember, only, well, in my time when I studied, it's not something that we focus on. I remember the point and shoot, right?
Yeah.
Setting, and that's about it. And when, early on, when people were asking me, is there something, do you have any exercise or anything that you can advise me about, leakage or erectile dysfunction, I would tell them, when I was in the Philippines, I would tell them, go see a doctor. And because I didn't have any background, so I didn't know what I know now. But do you think it is something that we should, like, at least, give more focus on in physical therapy education?
I think the hardest part in education for educating our educators and our students about pelvic floor muscles is the idea that this is a private part of human body. Not everyone will take off their pants right away, mainly because of our religion, our culture, our beliefs, especially in the Philippines. We are the most populated Christian, right? Catholic Christians in the world. We're very conservative. And I think it'll be hard for us. However, we are very much open minded. Are we Catholic? Being Catholic, we are open minded. I mean, even our Pope before say something about same-sex marriage. So just that gives us an opportunity to expand our education to our students. And I think the students will appreciate it. They could attend or not. I just want to share that was this one. I think for the country, I think India. I think mostly in the Middle East countries. I mean, they don't have pelvic floor therapists. The female pelvic floor physical therapist is treating men and women. But oh no, female pelvic floor physical therapist can only treat female, and men, and there's no one treating men because of their religion. Right? Pelvic floor physical therapists cannot touch male. So who will treat men?
Sure. Yeah, there are religions that only
Religion.
female healthcare workers can touch their same gender, and then
Right.
yeah,
And then it will come to the problem that men don't want to be touched by another man.
right, sure,
And this man who have a problem will find solutions somewhere else. Reddit, YouTube, Instagram, TikTok.
Right.
Did they solve the problem? No, because they don't have a guidance. They don't have the proper training. They find the generic treatments out there, thinking that they will solve the problem until it gets to the point that it gets hard to handle. And I don't want that to get to that point for us in the Philippines. I think there are Filipinos who are open to learn more about this, and I'm sure USD can expand their curriculum with pelvic floor, and I'll be open to that
I,
to come back. When have you come? When was the last time you came back? By the way, in
I,
USD
I go back every year and I try to
every. Okay, that's nice.
I try to maintain, I try to maintain connection with USD.
Oh,
I don't know. It's just nice to feel still connected, to have some, connection to your roots,
correct.
and then learn about what's going on, what's happening about, things in our profession.
Mhm.
So yeah, so pelvic health, and especially for men with male anatomy, it's something that a lot of men struggle with. Leakage. We talk about leakage. We talk about pain. We talk about intimacy issues, sexual issues, and all of those. So it's still hard to express, to open up, especially with partner. So what for those audience, especially those are experiencing that, those are struggling, having some problems, what's your message to them?
Just 3 words. Oh, no, actually, just 4 words. For those men listening to me, you got 4 words for me. You are not alone. You are not alone dealing with these concerns that you have. There are several men who are not talking about their concerns until it just gets worse. So please don't get to that point that you cannot go do your job. Don't get to the point that you cannot spend your time with your family, missing out outings, missing out your dinner dates with your wife, missing out events with your children, you missing out having a good time with your friends and family. Don't get to that point. Don't miss the opportunity of getting a promotion because you have trouble down there. And don't hesitate to reach out to physical therapists. Physical therapists know what they're doing. We are doctors of physical therapy. And every doctors of physical therapy has the capacity to rule things out, refer clients to a fellow physical therapist who is specializing in this. So don't hold back, reach out to healthcare professionals because you will find relief and solutions not just by watching YouTube, TikTok, Instagram to find answers. You can find help through physical therapists too. And don't just take medications, which is become popular. Like the hymns, I think
Right.
people just take Viagra so easily to get their erection back.
Yeah, a lot of ads are targeting erectile dysfunction.
Right,
There's the blue something, and then rouge or whatever. So
right,
it's there. I mean, it's an issue because
right.
there's medication, so
Correct,
there's a need. So I think it's a
right.
matter of the physical therapy profession in general trying to also push out the information that physical therapists can help in those areas as well. And for the physical therapists who are listening, especially male physical therapists, what would you say to those who are considering getting into this specialty or serving this population?
Oh, join me. Join me, please. Let's be a bigger part of the community. Let's make this part of the healthcare. When you join me, you will be helping thousands of men who are not just all kinds of men from all walks of life, cis male, gay, athlete, a dad, non-athlete who just IT who sits a lot, a kid who was taught don't go to the bathroom because remember there's also pediatric pelvic floor physical therapy who can go to the bathroom. Remember when we were a kid, you just can't go to the bathroom because you just had recess, and we developed this trauma when we were a kid.
Mm.
So help me make a change in our profession as a physical therapy, pelvic health, pelvic floor physical therapy. And be curious, stay educated. There's a big world out there that you could explore, and pelvic floor is just part of it. And for the new grads, I would say to hone your orthopedic and neurologic and neuro treatments, because this will be very helpful when you go to pelvic floor, to pelvic health. Oh, one more thing, let's not stop learning pelvic health through the con eds about how to treat them, but let's learn how to communicate with our patients. We, as a physical therapist, I think we were just taught do this everything like physical stuff, stretch, strengthen, but we forget how to communicate very well to our patients. Every patient that we see is someone's dad's brother, a friend, a partner, and they deserve respect and dignity in life. And through contents that you will learn about communication to our patients, it will help you. You will go a long way on treating your clients. And that is something that I'd like to share to all our pelvic floor, to the future pelvic floor physical therapists, especially men. We need you.
Pelvic health for men is such a niche area that I think it's still underserved, especially like in the Philippines. Pelvic health, pelvic floor rehab has just started to become something has just started in the Philippines with a lot of like I think certifications or organizations that are giving out or training physical therapists there. So we have pelvic floor therapists in the Philippines already, but I think not many of them are treating men, with
Mm,
male anatomy because most of them, or I think all of the attendees are women, and the the trainers are women, and they're actually just I think restricting the participants to women. So it's still underserved in the Philippines. So I
mm,
think with if they are gonna focus on this population, it's gonna be it's good for the if for the patients, and it
right.
would be good for them as well if they have the
Correct.
orthopedist because they're gonna be like
Correct.
in the forefront of that specialty. So if you wanna be that
Yeah.
pioneer, you can start there, like if you're in the Philippines.
Well, maybe I'll go back in the Philippines next year. I have a friend who owns a practice in the Philippines, and I already told him that I'm in this field here in the US, and I've learned a lot, and I'm happy to share it. So shout out to them. I'm looking forward to reach out to Filipinos who are interested in learning more about men's pelvic floor. And I think if not now, when, right?
Yeah.
We
I think
have to make a difference. I mean, there's a lot of men in the Philippines who sits a lot and in high stress.
right.
Uh, I think one thing that we just have to make sure that if we just have to align our thoughts, our education to men, and have a specific training only for men. And I'm sure not just women will come in, but more male physical therapists will come in because we are advertising specifically for men.
I think if you're gonna conduct a workshop there for pelvic health or male anatomy, I think a lot of people would attend that because
Yeah.
there's market to it. So yeah, so this is quite an interesting and very fruitful conversation that we have here. I usually end my interviews with my last bites. So these are questions that I didn't send you. This just
Yeah.
questions that I have here. So here are my last bite, my last three questions for you. So
Let's do this.
it's not related to what we're talking about, but it's about you. So
Oh,
my first question is my first bite, last bite. What
mhm.
keeps your plate full? So like what keeps you motivated or inspired?
Learning. I
Mhm.
just can't stop learning. I'm already 36, and I still enjoy reading books. I still enjoy reading journals. I still enjoy talking to a lot of people. I'm already a mid-level physical therapist, and I've been speaking to 30, 35 years in the business, and I still learn a lot from them. And I think that just keeps me moving because there's so many things I learned, not just facts, how treatment, but values. I learned a lot of values from them, how to stay in the business and help more people. And I would say it's also the patients. I mean, without them, I will not be on where I am right now. They make me smile every time I see, every time I they come in to me and say thank you because I've made a huge impact on their lives. So I think they're the one making me happy.
So learning and patience.
Right.
So the
And
next thing,
colleagues. Don't forget our colleagues.
uh,
The people who paved the way to pelvic health. Because I think, I mean, as you said, it's new in our profession. And without them being curious about how to take care of this part of our body, we will not be we will not be talking about it.
right. Okay. So next, second one, that second last bite.
Yeah.
You talked about learning earlier. This time, what's one thing you've unlearned that made you better at what you do?
Oh, unlearn. Oh, that that's a very different question. I unlearn to when you think you are right, don't think that you're always right because you have to look for other things to make you wrong. If you don't find them, then you're right. If you're wrong, if you found something that made you wrong, accept it.
Mhm.
It's okay to make mistakes. That's the beauty about physical therapy. It's okay if you're doing something, if you're stretching quads, but you have to stretch the hamstring. That's okay because you don't know that maybe the stretching your quads could help improve the movement of the pelvis. But it's okay to be wrong and accept it, learn from it, and share it with other people. I That's something that I love what I'm doing right now. I am sharing everything that I know, and it's okay to make mistakes. You have fallen once, several times, that's fine. You gotta get back up. There's no way but to get up.
I love that. I love what you said about if you think you're right, you might not be right.
You may not be
Sometimes
right.
because sometimes you're so fixated on, oh, this is it, and then
Correct.
sometimes it's not that. So
Correct.
it kind of goes into your bias, like what you're always
Correct.
doing. But if you always stick to what you know, you won't see the other things that might be affecting that. Just what you said. That's good.
Yeah, I think yeah, because sorry.
Go, go, go.
Just because when we are at this when we've been doing this for such a long time, we already have the pattern recognition.
Right.
Break that pattern recognition, you'll be smarter. You will see a lot of things. Too many things are you don't know everything. Once you connect the dots,
Mhm.
that you it's so wonderful.
Yeah,
It's such a big world.
yeah, you're right. We kind of it's right to recognize pattern recognition because what that's coming from our experience, but we shouldn't
Correct.
discard other things. We should
Mhm.
sometimes play devil's advocate to ourselves. Like if we know that this is it, if we're sure, what if we try this one? You know,
Correct.
just to spice things up. So just to challenge yourself if that's the right thing. So
Correct.
and my last bite is what are the three ingredients that make
Oh,
Cris Dervin Fedalizo?
well, three ingredients. I'll make sure that every client I see will learn from me
Mhm.
because I learn from them. I learned that I learned their lives. I have learned their hardships. I've learned their values. I've learned what's going in them. And they inspire me with their stories. When they come and see me, they are in their lowest part of their lives. It's another hurdle that they have to get through. And I will make sure that when they see me, I will help them. I will be part of their journey to get through this hurdle so that they can get back to their lives that they want to. And I will share that. I will share all my knowledge, skills, values, everything that I've learned for the 14, 15 years of being a physical therapist. Second, in addition to that, I'll make it fun. not just by learn. They will just not learn from me, but I'll make sure that they will learn a lot and have a good time with me. Because it's not just about making changes, but enjoying the journey. Because it's a long journey, guys. Pelvic health is such a long journey, and don't give up after a month or 2 months. Because in all my experiences with my clients, those who stayed strong, they were rewarded. Okay. Second ingredient with me, I think outside the box. I think that's the most important one of the most important part of pelvic floor PT is you don't just think about the pelvic floor. You think, why is this giving you a hard time? Why is this pelvic floor acting up on you? Is it because you have trauma when you were young that giving you this grip on your buttocks? Did you have did you fall or fractured your ankle or your knee 3 4 years ago that you were not telling me? Let's investigate further. I will help you think that pelvic floor muscle dysfunction is possible effect of what has happened to you in the past that lead you to me. Yeah. Last, wow. The last is always difficult, right? Actually, last one from me. Wow, this is tough. But I think the last ingredient that you could get from me is I will give you everything that I know. If you give up on me, I'll make sure that I will give up first because I have exhausted all avenues that I could provide to you. Sorry, I got emotional on that one. Been practicing for 14 years, and I will never thought that I will get to this point of in my life that I'm teaching online. I'm being interviewed by someone like you to share what I learned in my life and being the platform that I'll never thought about. I was just imagining this before, and I'm sharing everything that I know, my experience online, which is the new generation of learning. And I learned everything from the people I meet and the books that I've read, journals that I've been constantly reading, and I will exhaust everything to help you get through to your problem. So I know it's tough. When you have problems, it's tough. You get to the point that you want to give up because you can't find solution. And I'll do my best to help you find solutions for you. I will not be afraid to tell you that, and I've done this before. I've told my clients in pelvic health or even orthopedic, hey, I've seen you for 6 months, 7 months, or even shorter, 3 months. Orthopedic, 3 months. And so I've done everything I do. Try my colleague. He's more senior than me, or he has more specialty than me. I just don't know everything. I wish I know. That's why I love to learn because I want to make sure that I can give the best for all my clients to help them get their confidence, control, and strength back. Because life is short. Life is short, and you want to spend the most of your time with your loved ones. I think that's something that I wish I've done in the past. Spending time more with the loved ones, just kids. So yeah, and if I wasn't able to do that, I will help all my clients to spend their time back to their wives, their family, friends, to enjoy it. Maybe cry that one.
Sorry.
No, it's alright. It's just making me feel important again, making me feel there's a value in what I do, and yeah.
For sure. I know that there's your patients, really appreciate what you're doing for them. It shows in your passion on how you want your to help your patients by your the three ingredients that you said you shared with us. Trying to learn from your patients and making the journey enjoyable, thinking outside the box. Again, it's towards your patients, and for sure, your last one, you want to give everything, and that's not just that for me is something that points to excellence, but not just for excellence, but really passion to help someone, to help your patients, to give them the best that they can get from you. you know, and not many physical therapists, would go to that length, to help their patients. Some would say, like, even blame patients if they're not improving. But I feel the passion. I feel the strong advocacy there. So thank you for
Thank you.
being here and sharing that with us. This is such a great topic, and a feeling that we need to um, start having in the Artizo and through men's pelvic health advocacy. It's really huge because it's still a space filled with stigma of men not talking about it, and there's so much need to it. So thank you for
Thank you.
being here and sharing that with us. So if our listeners want to learn more about you, they can reach out to your Instagram, right? It's at Dervin Fedalizo, correct?
Yes.
And then
So yeah,
your website is artizollc.com, correct?
right.
All right.
Yeah.
So I'm gonna include that in our podcast description so that they can reach out to you. Any last words?
That's words. Well, thank you so much, Ivan, letting me be part of your journey as a physical therapist and a podcast. Definitely, this is a dream come true, and you're continue do what you're doing, because you're not just helping your fellow physical therapists, but you're making difference to the community in inside and outside world of healthcare, especially in the Philippines, who are also watching this or listening to this. And let's all make change in pelvic health, especially for men. Let's do this.
Again, thank you, Irving, for being in the podcast. To our listeners, if you learned something new today, share this episode with a friend, a colleague, or even someone who might need to hear it, that pelvic health isn't just for women; it's for everyone. And just like what Dr. Cris Dervin said, he's here to help men thrive above and below the belt.
Correct.
Yeah. So check out his website, Adam, and Instagram. So thanks again, everyone, for tuning in to PT Meal Podcast. I'm Johan de la Paz, and as always, let's keep learning, let's keep moving, and leading together. Till next time. Thank you.
Thank you.